Dr. Soto. I read a report that breast implants are causing cancer. Can you tell me more about this?
Right. So we're just learning about this ourselves worldwide. It seems that out of the, I believe now over 10 million breast implants that have been put in since we first started doing that procedure, there are a couple of hundred, so very rare, patients who have experienced as I say, very rare cancer associated with their breast implants. Now, this is not breast cancer. They're not causing breast cancer. It's a cancer that happens in the capsule or the shell around the breast implant. And it really only seems to be associated with breast implants that have what we call a textured surface. So most people know that breast implants can be divided into different categories. There's silicone implants and there's saline implants. But there's also categories based on the surface of the balloon, if you will. So the majority of breast implants are a smooth surface, and so you can think of it like a water balloon. The surface of the implant is very smooth. But we do also have these textured implants where instead of being smooth, the surface of the implant is kind of pebbly, almost like you put sandpaper on it or something. In my personal opinion, there's no benefit to that texturing. I don't like to use them. I think the results I get with smooth implants are beautiful, and there's no need to, in my mind, mess around with those textured implants. But some surgeons do like them, and some patients do prefer them. As of right now, all of the reports of implant-associated ALCL, or implant-associated anaplastic large cell lymphoma, which is what that cancer is called, have been with implants that have a textured surface. So as of right now, there's no confirmed report of a patient developing that cancer when she had smooth breast implants, which again are the only ones that we use here at Aesthetic Enhancements. So I think that the risk is very low for everybody, but it's extremely low if you have smooth surface implants. If you have textured surface implants, then I think you should think about your situation and go talk to your doctor. The cancers, when they have happened many years after the implants were put in. So if your implants are on the old side and you have textured surface implants, it might be worth talking to your doctor. Now, another question that often comes up in people's minds is, how would I know if I had this problem? Almost everybody who developed this situation had a very late seroma, which is what we would call a fluid collection around the implant happening years after the surgery. Okay, so if you've had textured surface implants or any kind of breast implant in place for many years, and you develop a swelling that is new, or a lot of fluid collected around your implant, or a new lump of some kind that you can feel, it would be smart to go visit your doctor. And this is also why, no matter what kind of implant you have, I think it's important to understand you shouldn't think of them as a lifelong device. No matter who did your surgery or what kind of implant you have, sooner or later you should realize you're going to need to replace them. Because when you replace the implants and take out that scar tissue, the risk is gone. So in other words, even if you were to develop one of these very rare cancers, by taking the implant out and taking the capsule or the scar tissue around the implant out of you, most situations you're cured of that problem. So it's not a very aggressive cancer, it's a very slow growing situation, and it really seems to be cured by taking out the implant and the scar tissue around it. So as long as you take good care of yourself, you see your doctor every year, and you go see them quickly if you find a change in your implants years after they were put in, I think the risk of a significant problem is very low. But at this time, I think that most of my patients are going to hear me say, you're much better off with a smooth surface implant. Because again, right now we don't know of a single confirmed case of this cancer occurring when the smooth surface implant is used.